Something happened inside your body this morning that you didn't feel. Between roughly 4 a.m. and 7 a.m., while you were still in bed, your blood pressure began to climb. Your heart rate increased, your blood vessels tightened, cortisol surged through your bloodstream, and by the time your alarm went off, the pressure inside your arteries was at its highest point of the entire 24-hour cycle. This is called the morning blood pressure surge, and in a healthy person, it's a normal, controlled process. Your body is transitioning from sleep to wakefulness, preparing your cardiovascular system for the demands of the day. Pressure goes up, heart rate increases, blood flow to the brain and muscles ramps up. It's physiology working as designed. But in millions of people, this morning surge is not controlled. It's exaggerated. It's steeper than it should be. It pushes blood pressure into ranges that damage arteries, stress the heart, and increase the risk of stroke and heart attack in the first few hours of the day. And the reason it's exaggerated has nothing to do with what they eat, how much salt they consume, or whether they remembered to take their medication. It has everything to do with what happened the night before, how they slept, when they slept, what they did in the hours leading up to sleep, and whether their body was given the conditions it needed to properly reset overnight. The silent habit raising your blood pressure every morning is not one single thing. It's a pattern of evening and nighttime behaviors that most people do without thinking, that destroys the quality of their sleep, prevents their cardiovascular system from recovering, and sends them into each new day with a blood pressure baseline that's already elevated before they've even left the house. In this video, I'm going to explain exactly how sleep controls your blood pressure, what happens when that control breaks down, and the specific habits that are silently making it worse every single night. This is the blood pressure mechanism that almost nobody talks about. And once you understand it, you'll never think about your evening routine the same way again. Hi, I'm Dr. Alex. I'm an emergency medicine doctor, and after nearly 10 years working in the AANDE, I can tell you that the most dangerous hours for heart attacks and strokes are the early morning. Between 6 a.m. and noon, cardiovascular events spike dramatically. And the reason they spike is directly related to what happens to blood pressure during and after sleep. I've seen patients arrive in the emergency department at 7 in the morning with strokes that were triggered by a morning blood pressure surge their body could no longer handle. My mission now is to help people understand why that happens and how to prevent it. If you're watching this, you're already more invested in your health than most people will ever be. And I want to make you a promise. I promise to keep creating the most helpful science-backed videos I can to help you prevent the diseases I see in the emergency department every single day. All I ask is that you give this channel a chance, hit the subscribe button and the like button right now. If you get to the end of this video and you didn't think it was worth your time, feel free to unsubscribe. No hard feelings, but if you give me your attention, I'll give you everything I've learned from over a decade in frontline medicine. So please subscribe, like, and let's get into this. To understand why your evening and nighttime habits matter so much for blood pressure, you need to understand what's supposed to happen inside your cardiovascular system while you sleep. Because sleep isn't just rest for your brain, it's the primary recovery period for your entire circulatory system. During healthy sleep, your autonomic nervous system undergoes a profound shift. The sympathetic nervous system, your accelerator, the system that keeps your heart rate up, your vessels constricted, and your body in a state of alert, steps back. And the parasympathetic nervous system, your brake, driven primarily by the vagus nerve, takes over. Heart rate drops, blood vessels dilate, kidneys shift into sodium excretion mode, and blood pressure falls to its lowest point of the 24-hour cycle. This overnight drop in blood pressure is called nocturnal dipping, and it's one of the most important cardiovascular phenomena that most people have never heard of. In a healthy person, blood pressure dips by 10 to 20% during sleep compared to daytime levels. This dipping period is when your artery walls relax, your endothelium repairs itself, your heart muscle recovers from the day's workload, and your kidneys clear excess sodium and fluid. It's a nightly cardiovascular reset. When nocturnal dipping is preserved, the morning blood pressure surge is smooth and controlled. Cortisol rises gradually. The sympathetic nervous system reactivates progressively. Blood pressure returns to its daytime range over a period of 30 to 60 minutes. The transition is gentle because the system was properly rested and calibrated overnight. Now here's where it goes wrong. When sleep is shortened, fragmented, or poor in quality, the parasympathetic takeover doesn't fully occur. Your sympathetic nervous system stays partially active through the night. Heart rate doesn't drop as much as it should, blood vessels don't fully dilate, the kidneys don't clear sodium efficiently, and blood pressure either dips less than 10%, which is called non-dipping, or doesn't dip at all, which is called reverse dipping. Research published in Hypertension has shown that non-dippers and reverse dippers have dramatically higher rates of cardiovascular events, stroke, heart failure, and kidney damage compared to normal dippers, even when their daytime blood pressure appears controlled. The 24-hour pattern matters more than the snapshot your doctor takes at 10 a.m. And here's the cascade that follows. When your cardiovascular system doesn't reset properly overnight, the morning cortisol surge, which is called the cortisol awakening response, becomes exaggerated. Instead of a smooth proportional rise, cortisol spikes sharply. The sympathetic nervous system fires hard. Blood pressure jumps instead of climbing gradually. And that exaggerated morning surge puts enormous mechanical stress on artery walls, particularly in the brain and the heart, during the exact window when most strokes and heart attacks occur. This isn't occasional, this is happening every single morning. It's a 365-day-a-year assault on your cardiovascular system, driven by a nightly reset that never fully completes. And the habits that prevent the reset are so normalized that most people don't recognize them as harmful. Blue light from phones, tablets, laptops, and televisions suppresses melatonin production in the brain. Melatonin is the hormone that signals your body to transition into sleep mode, and it also plays a direct role in lowering blood pressure overnight. When melatonin is suppressed by late-night screen use, the onset of sleep is delayed, the depth of sleep is reduced, and the parasympathetic shift that drives nocturnal dipping is blunted. Research published in the Journal of Clinical Endocrinology and Metabolism has demonstrated that evening screen exposure significantly reduces melatonin secretion and delays the circadian shift toward parasympathetic dominance. You're not just losing sleep time, you're preventing the hormonal cascade that your cardiovascular system needs to reset. When you eat a large meal in the 2 to 3 hours before bed, particularly one that's high in refined carbohydrates, your body has to divert resources to digestion at exactly the time it should be shifting into recovery mode. Blood flow goes to the gut instead of supporting systemic relaxation. Insulin spikes, which signals the kidneys to retain sodium rather than excrete it overnight, and blood sugar fluctuations during the night trigger cortisol and adrenaline releases that fragment sleep and prevent deep restorative stages from being reached. The result is that you wake up with higher blood volume because sodium wasn't cleared, higher vascular resistance because the endothelium didn't get its recovery window, and an exaggerated cortisol surge because your sympathetic nervous system was activated throughout the night. The meal you ate at 9 p.m. is directly shaping your blood pressure reading at 7 a.m. Your circadian rhythm, the internal clock that governs your sleep-wake cycle, your cortisol rhythm, your melatonin secretion, and your blood pressure pattern depends on consistency to function properly. When you go to bed at 10 p.m. on weeknights and midnight on weekends, or when you wake up at 6 a.m. some days and 9 a.m. on others, your circadian rhythm fragments, the hormonal transitions that control nocturnal dipping, and the cortisol awakening response lose their precision. Think of it as jet lag without leaving the country. Every time you shift your sleep window by an hour or two, your cardiovascular system has to recalibrate. And during that recalibration, nocturnal dipping is impaired, the morning surge is amplified, and your blood pressure spends more time in a dysregulated state. Studies published in sleep medicine reviews have shown that irregular sleep schedules are independently associated with higher blood pressure and increased cardiovascular risk, even in people who get adequate total sleep hours. Many people believe that a glass of wine helps them relax and sleep better, and it's true that alcohol has a short-term sedative effect. But what happens metabolically during the night tells a very different story. Alcohol disrupts sleep architecture by suppressing REM sleep and fragmenting the deeper stages of non-REM sleep that are essential for parasympathetic dominance and cardiovascular recovery. As alcohol is metabolized over the next 4 to 6 hours, it produces a rebound effect where the sympathetic nervous system activates and heart rate increases. This is why people who drink in the evening often wake up at 2 or 3 a.m. with a racing heart. Blood pressure rises during the second half of the night instead of staying in its dipped state. And the morning surge arrives on top of a system that was already elevated. Research published in Alcoholism, Clinical and Experimental Research has confirmed that even moderate alcohol consumption in the evening impairs nocturnal blood pressure dipping and increases the morning surge. This isn't a habit you choose, but it's a condition you may be living with without knowing it, and its effect on overnight blood pressure is devastating. Obstructive sleep apnea causes partial or complete collapse of the airway during sleep, sometimes hundreds of times per night. Each collapse drops blood oxygen and triggers a sympathetic adrenaline surge to restart breathing. The result is that your sympathetic nervous system fires repeatedly throughout the night, preventing any sustained parasympathetic recovery. Nocturnal dipping is often completely abolished in patients with moderate to severe sleep apnea. Blood pressure stays elevated or even rises during sleep, and the morning surge becomes a massive sympathetic spike on top of an already hyperactivated system. Research published in the journal Hypertension has shown that up to 50% of patients with resistant hypertension, meaning blood pressure that doesn't respond to 3 or more medications, have undiagnosed sleep apnea. If you snore loudly, wake up gasping, or your partner has noticed you stop breathing during sleep, a sleep study could be the single most important thing you do for your blood pressure. Checking work emails at 11 p.m., scrolling through news feeds filled with stressful content, having difficult conversations late at night, lying in bed, replaying the day's anxieties. All of these activate the sympathetic nervous system at the exact moment your body is supposed to be transitioning toward parasympathetic dominance. Cortisol, which should be at its lowest point in the late evening, gets a secondary spike from psychological activation. Adrenaline trickles into the system, heart rate stays elevated, and the transition into deep restorative sleep is delayed or incomplete. Your body enters the night already running hot, and it never fully cools down. The nightly reset that your blood pressure depends on gets compressed or skipped entirely, and the morning surge arrives sharper and steeper as a result. So here's the picture I need you to see clearly, because this is the part that changes everything. Every night that your cardiovascular system doesn't properly reset, the damage from that day is carried forward into the next. Sodium that should have been excreted stays in the system. Endothelial repair that should have happened overnight didn't. Arterial stiffness that should have been partially reversed by relaxation continued to progress. Sympathetic tone that should have been dialed down stayed elevated, and then the next morning arrives. The cortisol surge hits a system that's already overloaded. Blood pressure spikes higher than it would have if the reset had been complete. The arteries take more damage, the heart works harder, and the cycle begins again. This is the nightly compounding effect. One bad night doesn't cause hypertension, but months and years of incomplete cardiovascular resets, compounded night after night, is one of the most powerful drivers of chronically elevated blood pressure in existence. And it's happening beneath the awareness of the patient, the doctor, and the blood pressure medication. Your medication lowers your daytime blood pressure, but if your nights are sabotaging the reset, the medication is fighting against a system that starts each day already behind. This is why so many patients are on medication, following dietary advice, and still not reaching their blood pressure targets. The nights are undoing the days. And here's the part that matters most. This is fixable, not with a pill, not with a supplement, with a deliberate restructuring of what you do in the hours between dinner and waking up. Now let me give you the practical changes that protect the nightly reset and reduce your morning blood pressure surge. These are not vague sleep hygiene tips. These are targeted interventions that address the specific physiological mechanisms I've just described. Put the phone, laptop, and tablet away a full hour before you intend to sleep. This allows melatonin production to begin unimpeded, which supports the parasympathetic shift your blood pressure needs. If you read, use a physical book or an e-reader without a backlight. If you must use a screen, activate a blue light filter, though complete avoidance is far more effective. This single habit change directly supports melatonin-driven nocturnal dipping. Close your eating window at least 3 hours before sleep. This gives your body time to complete the major phase of digestion and allows insulin to return to baseline before the overnight recovery period begins. If you do eat in the evening, keep it light and protein forward rather than carbohydrate heavy. The goal is to enter sleep with stable blood sugar and low insulin, which allows the kidneys to excrete sodium and the body to shift cleanly into parasympathetic mode. Go to bed and wake up at the same time every day, including weekends, within a window of no more than 30 minutes of variation. This anchors your circadian rhythm, sharpens your cortisol curve, and ensures that the hormonal transitions governing nocturnal dipping and the cortisol awakening response happen at the right time and with the right intensity. Consistency is the single most important factor in circadian health. If you choose to drink, do so earlier in the evening and in moderate quantities. Ideally, alcohol should be fully metabolized before you enter deep sleep, which means finishing your last drink at least 3 to 4 hours before bed. Better still, for the purposes of blood pressure, reduce or eliminate evening alcohol entirely and observe the effect on your morning readings. Many patients are surprised by how significantly this single change lowers their morning blood pressure within the first week. If you snore, if your partner has observed pauses in your breathing, if you wake up unrefreshed despite adequate sleep hours, or if your blood pressure is resistant to medication, ask your doctor for a sleep study. Treatment with continuous positive airway pressure, or CPAP, has been shown in multiple clinical trials to restore nocturnal dipping, reduce the morning blood pressure surge, and significantly lower 24-hour average blood pressure. For patients with obstructive sleep apnea, this is not optional. It is one of the most powerful blood pressure interventions available. Deliberately transition your nervous system from sympathetic to parasympathetic in the last hour of the day. This can include slow, deep breathing with a prolonged exhale, which directly stimulates the vagus nerve, light stretching or gentle movement, journaling to clear anxious thoughts from the day, quiet conversation with a loved one. The specific activity matters less than the intent. You are signaling to your nervous system that the day is over and it is safe to stand down. Over time, this routine becomes a conditioned cue that accelerates the parasympathetic shift and protects the quality of the sleep that follows. And one essential note on medication: if you are currently taking blood pressure medication, do not stop or adjust your dose based on this video. These evening and sleep changes are designed to work alongside your medication, not replace it. When the nightly reset improves, your medication works more effectively because it's no longer fighting against a system that starts each day already overloaded. Over time, improved sleep may allow your doctor to reassess your medication needs. But that conversation always happens with your physician. In emergency medicine, the early morning shift is the one that shows you the real cost of poor sleep. The strokes that arrive at 7 a.m., the heart attacks at 6:30, the hypertensive emergencies at 8. The clustering is not random, it's biological. The morning blood pressure surge, arriving on top of a night of incomplete cardiovascular recovery, is the trigger. And in the vast majority of those cases, nobody had ever talked to the patient about their sleep. They'd been told to take their medication, they'd been told to reduce salt, they'd been told to exercise, but nobody had ever looked at the 8 hours of every 24 that their cardiovascular system is supposed to use for recovery and asked whether that recovery was actually happening. The patients I've seen who make the biggest breakthroughs in blood pressure management are the ones who fix their nights. They stop eating late, they put the phone away, they anchor their sleep schedule, they get screened for apnea, and within weeks their morning blood pressure readings start to drop. Not because a new pill was added, but because the existing system was finally given the chance to do what it was designed to do overnight. Here's what I want you to carry with you after this video. Blood pressure is not just a daytime problem, it's a 24-hour cycle. And the nighttime phase, the phase nobody talks about, is where the most important cardiovascular maintenance occurs. When that maintenance is disrupted by habits you've been doing without thinking, screens before bed, late meals, irregular schedules, evening alcohol, undiagnosed apnea, psychological activation at night, the damage compounds morning after morning, year after year. You cannot medicate your way out of a broken nightly reset, but you can fix the reset itself. And when you do, every other intervention you're making, your medication, your diet, your exercise, works better. The nights are the foundation. Fix the nights, and the days take care of themselves. The silent habit isn't one thing, it's a pattern. Screens suppressing melatonin, late meals spiking insulin, irregular schedules fragmenting circadian rhythm, alcohol disrupting sleep architecture, undiagnosed apnea abolishing nocturnal dipping, and psychological activation keeping your nervous system hot when it should be cooling down. Each of these prevents the cardiovascular reset your blood pressure depends on. And the morning surge that follows is the price your arteries pay every single day. If you recognized any of these patterns in your own life, tonight is the night to start changing them. Not next week, tonight, because the resets start when the habits change. If this video showed you something about your blood pressure that nobody has explained before, please hit the subscribe button and the like button. Every subscribe and every share helps this channel reach more people whose nights are silently undermining their cardiovascular health. And if there's a health topic you'd like me to cover next, drop it in the comments. I read every single one. Thank you for your time, and I'll see you in the next video.